All right, so today we're diving into something that might sound, I don't know, a little dry at first, but trust me, it's super fascinating. We're going to be talking about how our bodies process and get rid of medications.
Yeah, it's really amazing. It's like our bodies have this whole internal pharmacy going on, figuring out what to keep and what to toss.
Right, like a detective story almost.
Mhm.
We're going to track these drugs as they journey through our system,
Mhm.
figure out the clues to how they disappear.
Exactly. And the process is called drug clearance. It's basically the body's way of eliminating these substances.
Okay, so we're not just talking about how fast a drug vanishes,
Right.
right? It's more about the specific routes it takes, how it's broken down, all of that.
You got it. And it's not a one-size-fits-all situation either. So many things can affect this clearance process, like your age, genetics, even other medications you might be taking.
So it's a pretty complex system then.
It is, but don't worry, we'll break it down.
Great. Now let's start with the kidneys. They're always working hard, filtering our blood. What's their role when it comes to medications?
Well, think about it this way. As blood flows through the kidneys, they're like this super efficient filter, separating out waste products and sending them to be eliminated in urine. And that includes medications too.
So like a customized cleaning crew for each drug.
Yeah, exactly. And the term for this is renal clearance. It basically measures how effectively the kidneys remove a particular drug from your bloodstream.
Okay, so is there a way to measure or predict how much of a drug the kidneys clear out?
You bet. Scientists can actually use mathematical models to figure that out. They can predict how the concentration of a drug in your body changes over time, all based on this renal clearance rate. It's like mapping the drug's journey through your body, step by step.
Wow, so it's not just observation. We can actually use equations to understand this process.
Yep, pretty cool, right?
Definitely. And I'm guessing these models also factor in the concentration of the drug in both the urine and the plasma.
You're right on the money. Measuring those concentrations along with the urine flow rate tells us a lot about how much of the drug is being cleared by the kidneys.
That makes perfect sense. But I mean, our bodies have other ways of getting rid of drugs too, right? It's
Yeah.
not all about peeing them out. What about the liver or even just sweating?
Ah, you're thinking ahead. You're right, renal clearance is just one piece of the puzzle. There's a whole lot more to discover.
Okay, so the plot thickens. Tell me more about these other pathways.
Well, next time we'll dive into those other organs and processes involved in drug clearance. It's a fascinating journey for sure.
Sounds good. I'm already intrigued.
You're spot on. It's not just the kidneys working hard here. We use the term plasma clearance to talk about all the ways the body gets rid of a drug, not just through the kidneys.
So it's like the kidneys are important players, but there's a whole team involved in this drug elimination game.
Exactly. Think of the liver, for instance. It's like the body's detox center, right? It plays a major role in metabolizing those drugs, basically changing their chemical structure into something that's easier to eliminate.
Oh, wow. So it's not just filtering. It's like a chemical transformation happening in there.
You got it. The liver breaks those complex drug molecules down into simpler ones, sometimes even making them more active before they're finally eliminated. Pretty amazing, huh?
That is wild. But with all these processes going on at the same time, how do scientists even keep track of it all? How do they measure the overall impact of these drugs?
Well, that's where AUC comes into play. It stands for area under the curve, and it's a way to visualize the body's total exposure to a drug over a period of time.
AUC. Okay, so are we talking about like a graph or something?
Exactly. Imagine a graph with drug concentration on one axis and time on the other. The AUC is literally the area under that curve, showing us how much drug the body encounters and for how long.
Okay, I think I'm getting the picture. So a bigger AUC would mean either a higher concentration of the drug or a longer time in the body.
Exactly. And the key thing here is that this AUC value is linked to both the drug dose and its clearance.
So that means understanding AUC can help determine the right dose for a drug and how effective it's going to be.
You got it. It can even help predict potential side effects, which is huge for personalizing treatment plans.
That makes sense. It's like a unique signature for each drug,
Yeah.
how it interacts with a specific person's body. Now, I've always heard about a drug's half-life. Where does that fit into all of this?
Half-life, think of it as a timer. It's basically the time it takes for the concentration of a drug in the body to decrease by half.
Okay, so a shorter half-life means the body is clearing it out faster.
Exactly. And you know what? A faster clearance usually means a shorter half-life too. They're connected.
That makes sense. So why isn't half-life always mentioned on drug labels then? Seems pretty important.
That's a good question. It is crucial, especially for figuring out how often to take a medication, and if it might interact with other drugs. But you're right, it's not always explicitly spelled out on those labels. Doctors definitely consider it, though, when they're writing prescriptions.
I see. So a drug with a short half-life might need to be taken more often to keep it working, right?
You got it. It's all about finding that balance enough drug to be effective, but not too much to cause problems. And that's where half-life comes in, especially when you're thinking about interactions between different medications.
Right, because some drugs can affect how quickly others are cleared out, speeding things up or slowing them down.
Exactly. That's why it's so important to tell your doctor about all the medications you're taking, even over-the-counter stuff and supplements. It can get pretty complicated in there.
It sounds like it's like a delicate dance, all these drugs interacting in the body. Earlier, you mentioned those mathematical models that scientists use to predict how drug levels change. Can we dig a little deeper into that?
Sure. These models are based on the idea that the rate at which the amount of drug in the body changes depends on how much is already there and how quickly it's being cleared out.
So it's like a constantly shifting balance.
Exactly. We can even represent it with a simple equation. It's not as scary as it sounds. It just tells us that the rate of change depends on both the current drug concentration and the clearance rate.
Okay, so more drug, faster clearance, that means a faster change of the overall amount in the body.
Exactly. And to figure out what's actually happening over time, we also need to consider the starting point, how much drug was in the body initially.
So like setting the scene for the whole process.
Yeah, you got it. And once we have that initial condition, we can use some magic integration, it's called, to get a formula that shows how the drug concentration changes over time.
So it's like a prediction of what the drug levels will be at any given moment.
Pretty much. It's a key part of understanding how a drug moves through the body, how it's absorbed, distributed, changed, and finally eliminated. But it's important to remember that this particular model is simplified, assuming the drug is evenly spread throughout the body.
Right, like everything's happening in one compartment. But in reality, it's probably more complex than that.
Absolutely. There are more complex models that account for different tissues and organs, each with their own clearance rates. It's like a network of interconnected compartments with the drug moving between them.
Wow, that's pretty intricate.
It is. But even the simple model we talked about gives us some valuable insights into how drug clearance works.
Yeah, it's all starting to come together now. We've covered so much renal clearance, plasma clearance, AUC, half-life, and now these mathematical models. It's amazing how taking a pill can trigger such complex processes in the body.
It really is remarkable, and the more we learn, the better we can tailor treatments to be safer and more effective.
Yeah, it's like we're getting a peek behind the curtain, seeing all the intricate mechanisms at play.
And the more we understand these mechanisms, the closer we get to truly personalized medicine, tailoring treatments for each individual.
Speaking of personalized medicine, you mentioned earlier how people can differ in how they clear drugs. What makes someone a fast metabolizer versus a slow one?
Well, age is a big factor. As we get older, our liver and kidneys don't work quite as efficiently, which can affect how quickly we process and eliminate medications.
So older adults might need lower doses to avoid a buildup of the drug in their system.
Exactly. Dosage adjustments are often necessary as we age to make sure the treatment is both safe and effective. But age isn't the only factor. Our genes also play a significant role.
Right, I've heard about how genes can influence how quickly someone breaks down certain medications.
That's right. Some genes actually code for enzymes that are involved in drug metabolism. And variations in those genes can lead to differences in enzyme activity.
So some people might have enzymes that work really fast, quickly metabolizing drugs, while others have slower enzymes, meaning the drug stays in their system longer.
Exactly. It's like having a personalized set of instructions encoded in our DNA that determines how we handle these medications.
Wow, that's incredible. It really highlights the importance of personalized medicine, doesn't it?
It really does. By understanding someone's genetic profile, healthcare providers can adjust treatments to be more effective and minimize the risk of side effects.
This has been so fascinating. It's like our bodies are having this ongoing conversation with medications we take.
That's a great way to put it.
And by understanding that conversation, we can make smarter choices about our health. We've covered so much today: the role of the kidneys, plasma clearance, the significance of AUC and half-life, those incredible mathematical models, and now even the impact of individual variation. It's truly amazing to see the intricate processes at work every time we take a pill.
It is remarkable, isn't it? And the more we uncover about these complex interactions, the better equipped we are to make informed decisions about our health, and hopefully contribute to even more advancements in medicine.
Absolutely. Thank you so much for guiding us through this incredible journey into the world of drug clearance. It's been truly eye-opening.
It's been my pleasure. And remember, knowledge is power when it comes to your health. Keep asking questions, stay curious, and never underestimate the remarkable capabilities of your own body.